discharging.
Stay clear of patient.
Stay clear.
Deliver shock now. Press the orange button now. Shock delivered. Begin
CPR. Go. Sir, ready. Rescue breath. Okay, blow. Two. Compress. Rescue breath. Compress. Before you finish, your hand should be at the top of the chest. Rescue breath. Okay, switch. So you compress the chest. Compress it now. No, stay there. No need to change. Not like that.
Like this,
Sir. Okay, good. Compress. Go. Insert. Don't use your arm. Don't use your elbow. Pinch the nose. Don't use your elbow. Use your body. Go. Make it fast. Good. Don't use your elbow. Use your body. Make it fast, okay? Pinch the nose, chef. Pinch the nose. Okay, compress.
Analyzing heart rhythm.
Okay, good.
Do not touch the patient.
Don't use your elbow.
No shock advised.
No shock advice.
If needed, begin
How you will know if you need CPR? Check the airways, check the breathing, then recovery position. Okay, next. Who's the next partner? Who's the next partner?
Hello, are you okay? Hello, are you okay?
Other way.
No.
So once the victim is unconscious, ask somebody to call,
Somebody call to 999.
and then get the AED. Okay, start your
CPR.
CPR.
go.
This side up.
Faster, bro.
Okay, turn on.
Done हो गया.
Okay.
Yeah, done.
No, listen.
The patient bare chest.
What's the first command?
Detector next to flashing light.
Apply the fats, right?
Apply pads. Plug in connector.
Follow the instruction. No. Okay, next.
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient. Shock advised.
Okay, be ready for shock.
Charging. Stay clear of patient.
Don't touch.
Hey, don't touch.
Deliver shock now. Press the orange button now.
Press.
Shock delivered. Begin
Okay, good.
CPR.
Just start.
Okay.
वो डाल दे उसमें काउंट 30 हाँ
Hey, 30 only. One, two. Okay, compress 30. Count.
चल 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 फास्ट फास्ट फास्ट
Fast. Compress, huh?
चल चल रख हाथ रख उस पे
Compress. Okay, change.
वहीं रहे अरे संजय
Okay, compress the chest.
now he will press
Now
you will
you
press
compress the
no you
chest.
compress make 30 ओपन कर रहे उसको
Okay, go. Compress.
पैकेट ओपन कर पैकेट
faster, bro. The patient's died, bro.
या फास्ट लगा उसके अंदर लगा
Focus.
लगा नाम के अंदर 30 हो गया या
Pinch the nose.
नाक दबा उसका हाँ चल शुरू कर
When there is application,
Analyzing heart
Okay.
rhythm. Do not touch the patient. No shock advised. If needed, begin
Okay, check the
CPR.
airways. If your victim is breathing, no need for CPR. Alright? Okay, thank you. Okay, next. Who's the next?
ऑफ कर उसको मशीन ऑफ कर
Take it up again, Bhaskar.
security should go first you know
To finish now. Okay, go ahead. It's the AED.
When we finish with you,
Yeah,
perfect. Sir,
the
hello.
rest you have to stay.
AED at triple nine.
Good. Good.
Apply
Apply
pads
the
to
patch.
patient's
AED
chest.
patch.
Plug in pads connector next to flashing light.
Okay. Alright.
Apply pads. Plug in
Plug in
connector.
the connector. Dala, plug in the connector. Good.
Analyzing heart rhythm.
Wait.
Do not touch the patient. Shock advised.
Ready?
Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
Okay, compress. Madam, give pressure. Good.
I'm tired. It's not.
Okay.
It's not.
Yeah. Okay, one more. Give pressure. Good. Rescue breath, fast, rescue breath. Okay,
This is alive.
now you apply rescue breath. Change umbrella, you compress the chest, apply rescue breath. Make it fast, make it fast, make it fast. Good. Press. Make it fast, Abdullah, make it fast. Compress.
Because he's alive.
Finish the 80. Just the breath. Compress.
Analyzing
Okay,
heart
good.
rhythm. Do not touch the patient. No shock
You know, short
advised.
advice.
If needed, begin
Okay, check the airways
CPR.
and the breathing.
Perfect, he's alive.
Okay. All right. Next.
Nice. Off machine. Machine off.
Cell phone.
Sir, kailangan ko yung picture nila at saka yung slide yan.
You go.
So, are you okay? Are you okay, sir?
Photo, ah. Photo and video. Okay, good.
Call 911.
Because
Very
you
good.
did very good job. That's why.
Good.
Very fast. You need to fast.
That's a good call. That's a good call. Very good.
Apply pads to patient's bare chest. Plug in pad connector next to flashing light.
Good.
Thank you. Thank you.
Apply pads. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the shock delivered. Begin CPR.
Samuel Center. Samuel Center.
Look for the nose.
Okay, switch. Compress. Very good.
Little.
Ito may mag-asa ba ito? Oo. Patay tayo. Go, 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 go. It's like having a push-up, right? Press, go press.
Analyzing heart rhythm.
Very good. See, if you will do
Do
it
not
alone,
touch the
after
patient.
CPR, you're the next victim.
No shock advised. If
Okay,
needed,
very good,
begin
right?
CPR.
Is okay.
Okay, nice. Okay, who's the next? Who's the next? Next.
Are you okay? Anybody here? Call the ambulance and bring the CPR.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay. Plug in,
Apply
plug in.
pads. Plug in connector. Analyzing heart rate.
Remove your.
Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
Compress. Good. Guys, again, you can delay the ventilation, but don't delay the chest compression. Okay? Okay, switch. Yeah, you should break the chest, guys. It's very tiring. Rest your breath. Good.
Analyzing
Okay.
heart rhythm. Do not touch the patient. No shock advised.
Grabe yan.
If needed, begin
Okay.
CPR.
Check the airways. If the victim is breathing, you're good to go. Okay?
Yeah.
So who's the last? And then we will continue with the lecture. See guys, it's very tiring. What more than the real person? Add your stress, add your panic mode, add everything, add the people around you shouting at you.
Yes.
You think you can compress? Don't do that, don't do that. Listen to the nurse. Listen in one person.
Exactly.
Who's the first aider for that day? Listen to him. Okay, go ahead, guys.
Hello sir, are you okay? Are you okay?
Very good.
Call a triple line.
Good. Good call. Good. Don't press it. Don't press it. All right.
Apply
Follow the
pads to
instruction, huh?
patient's bare
Follow the
chest.
instruction.
Plug in pads connector next to flashing light.
Then plug in. Because the AED will not work.
Hmm.
Alright? If you
Do not
interchange the
touch
pen.
the patient. Shock advised. Charging.
Ako naglaro ng basketball.
Stay clear of patient.
Naging na nga ako dito eh.
Delivered
Ako
shock
dito,
now.
sa ano,
Press the orange button.
lagi na yung COVID.
Shock delivered.
Araw-araw.
Begin CPR.
Parang kaya ako ulit na.
We need to be continue this one if it's still breath is not come up.
Yes, the AED will inform you.
Okay.
If the AED told you, to rescue breath, not lips to lips.
Enjoying.
Okay, good. If the victim is beautiful, okay. Enjoy. But if the victim is made too only,
So machine will tell us. I mean,
yeah.
it's required or
No
not.
shock
Yes.
advice means the victim is breathing.
Okay. Great.
Okay, compress, good.
That's why we need to focus.
That's why we need to listen to the AED.
Yeah.
Because if the environment is too loud, you cannot hear the AED.
Exactly.
Okay, good. So during emergency, focus on the partner and the AED.
AED, only
Don't listen to those asshole around you.
For example, funeral.
Don't do it alone, man. You'll be sorry, believe me.
दो रे दो बस ए दूसरे के पता नहीं मुझे काट दे तो चलो
Ano channel ka na wala?
मतलब घर लेकिन वो फिर को
Saan ang hanapin mo doon?
हेलो
Don't use your elbow, use your body.
हैं
Guys, if you use this one, you cannot compress the chest. Believe me.
नहीं वो कर देगा अपना मुश्किल नहीं करेगा तो मैं कर देगा
Ano pag training mo ito ng advanced course, yung may spine ball, yung may cervical ball, tatambling mo mga.
Analyze
Okay,
advised.
good.
Do not touch the patient.
Yan nag-ICL.
No shock advised.
Oo, ikaw.
If needed, begin
Baka
CPR.
bahala sa buwan. Okay, good. How do we know if it is CPR? Okay, good. Alright. Everyone is done, right?
Yeah.
Okay, so give me another 30
Yeah,
minutes.
agree.
We wrap up the lecture. Now we go to
पता नहीं अभी 10
oxygen
15
therapy.
20 मिनट और
Okay, guys.
हम्म
Guys, look at this. Face mask. Rebreather. Listen. Cannula means, you see that, you can see this in the hospital, the two tube.
Yes.
Right? That's the cannula. Okay? If you're using the cannula, the patient can take advantage. From 20 to 30% of oxygen at the flow rate. Flow rate. What's the flow rate? 5 liters per minute. How many percent of oxygen? What are you using? Cannula. The normal oxygen consumption of a person is 5 liters per minute at rest. At rest means when you are sleeping. Well, right now, activities of daily living, you are consuming 8 liters per minute. 8 liters per minute. You got it? 8 liters per minute. If you do exercise, 50 liters per minute. 50. If you are on a panic mode, 100 liters per minute. Okay, now, if you're using the cannula, you will give 20 to 30%, approximately 20 to 30% of pure oxygen. What's the flow rate? Okay, now, cannula. What if the victim is having a difficulty in breathing and you're using the cannula? Are you going to increase the oxygen supply? See, this is the gauge. Where is the 5 liters per minute? 1, 2, 3, 4, 5, 5. So it's showing the gauge. Huh? You see the pressure? I can feel the pressure. If I'm using the cannula, if you have a difficulty in breathing, if I increase it with 10 liters per minute, what will happen to your nose? You suffer from bleeding. See,
Too much,
you see the pressure? Okay. Feel it in your nose. You suffer from bleeding. Because now, what should I do? I will use the face mask. Where's the face mask? This is the expired na ba to? This is the face mask. Now, if I'm using the face mask, the victim will take advantage . 60% of oxygen. What's the flow rate? Can we apply the 5 liters per minute? No, because the mass is too big, right? It's not enough. So you increase it by it's easy, right? Right? Now, again, your victim is having a difficulty in breathing. Do you need to increase the flow rate using the face mask?
Yes.
If you increase, what will happen? You will damage again the nose strip because 15 liters per minute is it's too strong. Now you will use the rebreather. The rebreather mask is like this. This is the mask, and there's one bag here. Right? Check the 15 liters per minute. How strong? It's very strong. It can damage your nose strip. But if you're using the mask with the rebreather, oxygen will be scattered. Pure oxygen. Okay? You got it?
So in hospital, you say that they are using cannula.
Cannula.
So why? Because it's more difficult, no, cannula compared with other two.
In the city,
No.
they use this one.
Mostly I saw this.
This one.
Sometimes they put medicine also. Yeah, but this one for because they can give medicine.
Some hospital they're using this one. But what if your patient is suffering from claustrophobia? You don't want to close the nose and nose. So you don't have a choice but to use the cannula. But the problem with cannula, you cannot raise it to 10 liters per minute. You might suffer from nosebleed. Alright, if you're using the rebreather, %, pure oxygen, 15 liters per minute. Flow rate, the maximum is 15. Clear? Are we clear? So if you have one guest here, he's suffering difficulty in breathing, and you don't have the cannula, but you only have the mask. You give the mask at what's the flow rate? 10 liters per minute.
This is the maximum. Even I
That's the maximum.
so
If
based on
you want to increase, you replace it with rebreather. If you're using the cannula, the maximum is 5 liters per minute. Usually in the hospital, 5 liters per minute is enough. and with the pulse off. You can see that the blood oxygen is dramatically increasing. Clear? That's how you use the oxygen. Again, when are you going to use the oxygen? Difficulty in breathing. That's all. Whatever the injury. Clear? Are we good? Okay, now let's go to burns. Alright?
All in kitchen. Chef. The one who is supposed to. Is it?
Recovery position.
Recovery position is there.
Guys, what is a wounds? This stage. What is a wounds? What do you call a wounds? Break in the continuity of the skin is what we call wounds. But we have to be more specific. We have to identify what kinds of wounds. You cannot say that, chef, you're suffering from head wound, elbow wound. No. You have to be more specific. We have to give a name to each wound. Number one, we have what we call this avulsion wound. Avulsion. The skin has been separated from the body. We don't know what happened. Animal bite, scrape, unable to locate. Next. Minor scratches, abrasion. At least you know how to distinguish. Abrasion wounds. Okay?
Minor. This is minor.
This is minor abrasion. But we have severe abrasion, right? Motorcycle accident.
Yeah.
The whole body is suffering from abrasion wound. This is the most painful. Next, penetration punctured wound. Okay. If there's an embedded object here, do not apply CPR. You double kill the victim. If the victim is bleeding, do not apply CPR. If you can stop the bleeding, yes, but it's too late, guys. It's difficult to stop the bleeding. But try. Okay? Laceration means multiple cuts, one or two more than cuts. You see the cuts, it's irregular, it's not uniform. Okay? Incision means one single, but the cut is very deep. Okay? Now, in kitchen, chef, what are you going to do if you suffer from amputation? What are you going to do to the limb?
Sprain.
This has been removed.
So we'll try to take the
Okay, stop the bleeding.
Yeah.
What are you going to do to the finger?
we put it back.
You wrap it. Don't put it in the freezer, huh? You wrap it, you place it in the ice, but you wrap it because it can cause frostbite if you apply directly to the ice. Clear? And give it to the paramedic. Do not throw it.
Wrap it with the
Wrap it with paper towels or anything. And then you place it on top of the ice. Not direct ice. It will suffer from frostbite. You have to defrost it. Clear?
Frostbite.
Frostbite. You see that? You see your meat, how hard it is? That's what we call the frostbite inside your fridge.
I mean, we take the ice, we can put something on top and then we can wrap this fingers and we can do so
Yeah.
indirectly.
Yeah, indirect, okay? Now, contusion means internal bleeding, huh?
What's that?
Okay? How you will stop the bleeding, guys?
It's internal.
How you will stop the bleeding?
By covering.
Put pressure.
Apply pressure. If the first clot is full of blood, don't remove. Apply another clot. But again, guys, to be honest, it's difficult. It's very challenging. You wrap it, you elevate. After elevation, you apply the tourniquet, it will not stop. You will lose the victim. 100%.
If the blood is continuous.
Yes.
But paramedical, of course.
Even the paramedic, I encountered a lot in Salvador. We did not stop the bleeding, the victim died. If the victim is bleeding, if I saw the victim unconscious and I saw a lot of blood, I pray. Because for sure the victim will die. Okay, but still, do something to stop the bleeding. Okay? Because that's the only thing. Stop the bleeding, whatever it takes. Clear? Okay. Let's go to, this is the tourniquet. You know how to apply tourniquet, right? Anything can be a tourniquet. Piece of cloth, piece of handkerchief. If you have the tourniquet, you can use it. Nose bleeding,
Down.
head down, not head up. Huh? Pinch the nose, open the mouth, breathe in your mouth. The blood will drip outside the mouth. Okay? Burn. We have 3 kinds of burn, right? Electrical burn. If someone suffered from electric burn, be sure that the electricity is switched off. Temperature and okay. Now, what is a first degree burn?
Sorry?
First degree burn. Sunburn. What's your first aid for sunburn?
Lotion.
Lotion. Take a bath. It's not a serious thing, right? Now, what is a second degree burn? Second degree burn, there's a water. Blister. Guys, again, it's only basic. We will only deal with small burns. Big burns, don't take the risk. You call the ambulance. Small burns, you know what is a small burns? Difference with big burns. Small burns, water, burn spray, you're done. But big burns, send it to the hospital. Especially third degree burn. How you will know if it is a third degree burn? You can see the muscle. This is what we call the full thickness burn. Are we clear? Big burns, don't take the risk, don't apply anything. Clear? Send it to the hospital. Are we good? Okay, so last topic, fracture. In fracture, we only have 3 things. Close, open, dislocation. Dislocation, don't try to put it back. You put ice, you call 999. Open fracture, the bone destroy the skin. Focus on bleeding. Right? The bone destroy your skin. Now, what is a closed fracture?
No.
Inside.
Yeah, bro. I mean that.
How you will know if a person is suffering from closed fracture?
Maybe a 10.
Okay. For example, this one. Suspected fracture. We have to bring him to the hospital. So we need to support the limb. How are we going to support it? How are we going to support the limb? Use this one. If you don't have this one, you can use cartoon, right? Sir, I need to transport you to the hospital. Don't make any further movements.
Random.
You get the bandage. No further movements. Just bandage it, stabilize. Now, you get the triangular bandage. Where's the tip of the triangle? The tip goes to the injury side. Where's the injury side? Right. Okay, sir. Stay back. You stand. Deep pressure. Stable. Okay, that's the triangular bandage, guys. And then transport the victim to the hospital. At least no more further movements. Are we good?
Sick leave nurse, how many days?
Sick leave nurse.
7 days.
Okay, so any question, guys?
Yeah, question. For example, like
Go ahead, sir.
we don't have these.
You don't have this one.
Yeah, can we use a hard?
Hard object cartoon, or you can use two phones, two iPhones, huh?
It's one of the board, no?
Yeah, clip.
Board. Clear? Okay, do we have any question, guys? Again, the most important thing is CPR, oxygen, AE. Clear?
Question, sir, burn. Chemical burn.
Chemical burn, okay.
Yeah, this
we
one
have,
here in the face. What
we
do
have
you
two kinds of chemical. We have powdered chemical and liquid chemical. Powdered chemical here. Do not apply water because the reaction, you brush it. Chemical burn, acid, water, running water, cold water. Cold
Cold
water. Clear? Because chemical is hot. If you apply hot water, you will aggravate this. You will aggravate the situation. Cold water. Okay? To lessen the acid. Usually the chemical that can burn, acid base, no more. Inhalation of chemical, it's difficult, suffocation. We have to bring the victim to the hospital.
Burning, you can use cold water, no matter.
Yeah, it's okay.
Cold water.
But do not apply direct ice. Running water, cold water. Okay? After that, burn spray, wrap it. Small burns only, huh? Big burns, send it to the hospital.
Burning is good to wrap.
Which one?
When you have.
Of course, you have to wrap it. You will suffer from infection. As long as you disinfect, you put burn spray, antibiotic cream, you wrap it, you're done. Small burns. Big burns, send it to the hospital. Clear?
Yes.
Any question, guys? Are you sure?
Another one, sir.
Go.
Amputated, this one, small cut here, then the nails, then bleeding
Stop the bleeding.
by the machine. Yeah.
Crush.
Yes. Cut here.
Cut. Stop the bleeding.
Pressure also.
Hold up.
You don't have a choice but to stop the bleeding.
Stop the bleeding. Keep it up like that. Right.
No, stop the bleeding. Just stop the bleeding. You want to apply tourniquet here. Just stop the bleeding. Ice. Okay? Guys, if there's a bleeding, the only thing that you need to do is to stop the bleeding. Okay? Burn, cool the area. Clear? Come on, question, guys. Did you learn something today?
Yes.
No.
Alright, so if you panic,
Nothing can work.
nothing will not, guys, remember.
I missed this one. Sorry.
It's okay. Victim is a victim. You cannot do something about it. Let's have a recap. Cannula, What is cannula?
On the nose.
On the nose. Maximum
5 liter.
5 liters per minute. The victim can take advantage 20 to 30% of your oxygen. But if the victim is having a difficult